Good morning. Thank you all very much for coming today. We have called this press conference to make you aware of a recent case that signals a significant new advance in our ability to care for individuals with upper extremity amputation. On May 27, we completed the first hand transplant in the state of North Carolina. The patient is sitting here with us today. Mr. Rene Chavez is a remarkable man whom I am sure you will enjoy meeting this morning. This procedure is the result of years of preparation by scores of individuals, including surgeons, physicians, nurses, anesthesiologists, therapists, social workers, pharmacists, organ procurement professionals, administrators, and others, all coming together to help Mr. Chavez regain better quality of life and improved upper extremity function. While this could be considered as an end product or accomplishment, we prefer to consider this the beginning of a comprehensive vascularized composite allograft clinical program backed up by a very deliberate investigational program that we hope will advance this field. It is our goal to bring reconstructive transplantation to deserving individuals such as Mr. Chavez, who have limb loss or other non-reconstructible tissue defects. Before opening this up for questions, I would like to make a few acknowledgments. First, this is a collaborative program within Duke Health, and it has been driven in large part by concerns for our servicemen and women returning from deployment with amputations and other significant injuries. As such, this work was sponsored by a grant from the Department of Defense. We would like to acknowledge the United States Army Medical Research and Material Command and read a statement provided by the Department of Defense spokesperson of record and vascularized composite allograft subject matter expert Wendy Dean. And I'm going to open the quote. The United States Army Medical Research and Material Command supports efforts such as the clinical trial Regenerative Medicine, Pain Sensory, which bring together leading scientists, clinicians, and industry partners to develop innovative medical solutions to restore war fighters to form and function after traumatic injuries. Since 2009, the Department of Defense has funded more than $45 million in hand and face transplant research, focusing on innovations offering immediate benefit to troops injured in combat and to civilians suffering traumatic injuries. Hand transplants, such as the procedure performed in May at Duke University, offer the hope of improved function and the promise of a better quality of life for our injured service member and civilians. Close quote. Second, this has been a multidisciplinary effort, pooling resources of the Departments of Surgery, Medicine, Orthopedic Surgery, Rehabilitation, the Duke Transplant Center, the divisions of plastic surgery and hand surgery, and the Duke University Hospital. We recognize that this is a new beginning for Mr. Chavez, as is the case for many recipients of other transplanted organs, and the next year we'll see a rigorous schedule of rehabilitation and a requirement for, like all other transplants, immunosuppressive medication. Finally, we want to thank Mr. Chavez for agreeing to tell his story today and participate in this pivotal advance for our program. I am sure you will have many questions, but I am also sure we can count on you to respect Mr. Chavez's privacy outside the venue of formal press gatherings such as this one. Of course, none of these or any other transplant would be possible without the altruistic gift from the donor family. At the request of the donor family, we will maintain confidentiality regarding their donation and send our sincerest respect, sympathy, and gratitude in this difficult time of grief. I'd like to introduce now the members of our panel today and then open up for questions. So from your left to right, Dr. David Ruch, who is the chief of the Division of Hand Surgery at Duke. Joel Peña, certified medical interpreter from the Duke International Patient Services. Mr. Rene Chavez, a hand transplant recipient. And to my left, Dr. Allan Kirk, chairman of the Department of Surgery and Surgeon-in-Chief of Duke University Health System. And I'd like to open up for questions. Yes.
Mr. Chavez, could you explain your story and how did you hurt your hand during your childhood?
I explain in Spanish because my English is not too good, pero translate. I don't know if it's too comfortable for you, pero I explain in Spanish and translate. Quizá jugando con unos
I was playing with
aparatos de carnicería, meat market.
some devices that are used in the butchery.
Junto con otro hermano,
I was playing with one of my brothers.
metí la mano y
I put my
estaba
hand
jugando,
in there.
y él
I was playing,
le prendió.
and he turned it on.
Aunque fue poco el daño,
And even when the damage was small,
quizá no fui al lugar correcto y
maybe I didn't go to the right place at the moment,
perdí la mano y parte
and I lost my hand and part of
del brazo.
my forearm.
Así fue como
That's how
I lost my hand.
I lost my hand.
A little bit louder.
¿Ves?
¿En qué año fue eso?
20 years ago when I was young, 4 years young.
I was 4 years old.
A ver si esto se ve mejor.
Was do you want me to use this one instead? And, okay. Okay. I was 4 years old when it happened.
Another question for Mr. Chavez.
Otra pregunta para el señor Chávez.
I'm sure it's really hard to explain.
Sé que es muy difícil de explicar pero cómo se siente.
Me siento
I feel
ahorita
now?
me siento bien.
I feel well.
Me siento bien.
I feel well.
Creo que estoy logrando
I think that
una
I'm
meta
achieving a
que
goal
quizá en mi vida
that
no
maybe
le iba a poder conseguir.
in my life I wouldn't be able to achieve.
Pero físicamente y
But
mentalmente me
physically
siento
and mentally,
bien.
I feel
contento.
well. I'm happy.
Y creo que hay muchas
And I
cosas
think
para
there are
seguir
many things
a probar.
to continue
Ya que
to
hoy había
prove.
Conocido muchas cosas, pero creo que
I think
esto va a ser
that I knew
algo
many things, but
realmente
I think this is going to be
grande y nuevo,
something
y
really
gracias
big and new.
a la ayuda del
And thanks
los
to
médicos
the help of
presentes
my
de la
doctors
universidad y de las personas que
and the
aportaron
university and all the people
para que
that
esto fuera realidad.
helped to make this happen.
Quiero hacer hincapié en eso,
I would like to emphasize
en agradecer esa parte.
that I really appreciate that, and I want to thank all of that people,
Sobre todo la atención de las personas
especially
aquí.
the care that I was given here.
Y estoy muy contento.
And I'm very happy,
Estoy muy contento.
very happy.
Mr. Chavez, you
Señor
lived
Chávez,
most of your life with
Usted vivió casi toda la vida sin su mano. ¿Por qué decidió después de tanto tiempo someterse a esta cirugía tan compleja después de tanto tiempo?
Porque no había investigado yo que se pudiera hacer.
Because I hadn't investigated on this, I didn't know that it
Hace como 3
was
años y medio,
possible that
buscando
this
en
could
el
be done.
internet.
3 years ago, I was surfing in the internet and I found out about
Y
this.
así fue como me di cuenta que podía haber una
And
oportunidad
that's when I realized that I had
de
a chance
sentir o
to
de
feel,
saber qué se siente.
to know how it feels.
Porque como yo lo perdí muy pequeño.
Because I lost
yo
it when I
mi
was
vida
very
la viví
little, and all my life I
prácticamente
lived
yo la sentía como normal.
like it was normal.
Pero creo
But
que hay algo
I think
diferente.
there's something different.
Entonces investigué y fui
So I investigated and I continued to go on step by step.
Sé que esto se ha practicado en
I know that
otros lugares,
this has been done in some other places,
pero en realidad yo
but really,
vengo persiguiendo a la persona que creí que era la que mejor me podía
I've been
ayudar.
tracking down the person that I
Tengo aquí a mi lado.
received that could help me the best way, and that's the person that I have on my left side.
Sé que no es ella nada más.
I know that's
es
not only her,
mucha gente
it's many people
la que me está ayudando,
that's
incluyendo a
helping me,
ustedes, porque
including
sí es
you,
confortable platicar
people,
con
because
ustedes.
it's very comfortable and pleasing to talk to you.
Pero apunta uno a algunas personas en
But
especial.
you have to name some people in
Quiero
special.
agradecer que todos vengan
But I want to thank you all for coming
y
here,
ayudar.
and I also want to help. I thank everybody that has helped me.
I don't know when you're gonna start using your hand or feeling on your hand, but what
No sé
would be
cuándo
one of the
empezó.
first things that you would like to do?
No sé cuándo usted va a empezar a sentir su mano, a usar su mano, pero ¿cuáles serían las primeras cosas que usted quisiera empezar a hacer?
Es que ya la hice. I already do it.
He's already did it.
I move a little bit my finger.
I moved my finger a little bit.
I can do it right now, pero maybe you believe me.
I can't do it right now, but maybe.
Pero ya hice mi primera cosa.
I did my first thing already.
Doctor, what made Mr. Chavez a perfect candidate for a hand transplant?
Oh, I'm sorry.
So the question was, what made Mr. Chavez the perfect candidate? I want to emphasize that this is a clinical trial and it's still a procedure under investigation. Our program does a very thorough evaluation that includes many aspects, including radiology, lab work, of course, a psychosocial evaluation, technical, and it's a combination of what, you know, in our opinion, is a recipient or is someone who will benefit from it. We, as a field, we have not defined specifically one thing or another, but it's a combination of things that we think would benefit.
Are you concerned that the body may reject it? Is that a possibility?
So certainly anytime a transplant's performed, the possibility of the body rejecting the organ exists. One of the unique aspects of this particular trial is that it's using a new form of immunosuppression that has lower toxicity than what would be typically the case in an organ transplant. And indeed, while hand transplantation is an unusual procedure anyway, this is the very first time that this approach has been used in anybody. What we would hope is this will provide Mr. Chavez with the ability to go about his life without being encumbered by the drugs that are usually associated with preventing rejection. It's actually biologically quite a special case beyond the uniqueness of the transplant.
With that in mind, Doctor, could you describe any follow-up care that may be required by Mr. Chavez?
So the follow-up care is very intensive. He is going to have rehabilitation, as I tell him is his full-time job. He will also have a follow-up for immunosuppression, a follow-up from social work, from psychology. The first 2 years is very, very frequent, and then subsequently we will follow him as any other transplant surgeon, which is at least once a year and as needed.
Beyond the follow-up that's necessary for the medical care, as this is an experimental trial, there will be opportunities to follow up Mr. Chavez in investigational ways. Certainly, the ability to do limb transplantation has its intuitive and obvious benefits, but since Mr. Chavez has not had a left hand for 50 years, understanding how his brain will reintegrate and become cognizant of his left hand will have extraordinary potential to teach us about how individuals not only recover from amputation, but also recover from stroke or spinal cord injury or traumatic brain injury. And indeed, the scope of this trial goes much farther beyond the obvious replacement of a limb, which by itself is quite remarkable. But it has the potential to help many, many patients beyond the individuals that were being treated right here.
Doctor, what does this mean for other people here in North Carolina or really across the country? Does this open significant doors?
Yes, I think this opens doors not only for our population at Duke, North Carolina, but worldwide. We are one of the very few centers in the United States that have performed hand transplant and that have a comprehensive approach to this new field, which is the transplantation of tissues to reconstruct defects of large tissues. As the DoD spokesman said, it's not only for our servicemen and women, but also the hope for any civilian who has lost a limb or a defect that could be reconstructed with transplantation.
Dr. Ruch, you might want to add how this integrates into the entire continuum of upper extremity care, because Duke has always been a leader in replantation. In fact, many of the replantation skills that were developed for the world were developed right here at Duke. And so perhaps Dr. Ruch might want to speak to that.
Thank you. I think that the opportunities exist with transplantation surgery that really don't exist many times for mutilating injuries, both in the civilian population as well as in our military population. And sometimes, no matter how hard we try, we can't save a limb. This offers us an opportunity to replace a mangled extremity with one that potentially has far greater function. In addition, I think it's interesting to note, and I think you'll find that the recovery of these limbs is greater and faster than what we get with traditional salvage operations. Nerve recovery has been shown to be much faster in these than we get in traditional replants. So I think the opportunity to have a much, much better extremity exists with this first procedure than what we've traditionally been able to accomplish.
Mr. Chavez, what is your occupation?
Working a car dealer. Car dealer.
And how long will you have to wear the cast?
Not a doctor.
We anticipate that at least he will have some type of splinting for the first year.
Dr. Kirk, could you explain how this anti-rejection drug is different from the ones that you used previously in transplants?
Yeah, certainly. So typically when we use immunosuppressive drugs, it prevents the immune system from functioning, and so while that prevents it from rejecting the graft, it also prevents the normal function of the immune system. Through years of work, much of which has been done in Dr. Cendales' laboratory, we've been able to find that a drug known as Belet allows for the immune system to engage with the organ and adapt to it rather than just shutting the immune system off. So by working with specific aspects of the immune system, we're basically training the immune system to accept this organ as the patient's own, as opposed to shutting off any communication. And I'd make the analogy of trying to teach. It's hard to teach something that someone can't see, but it's easier to teach if you can show someone something in the right context. This drug blocks certain signals that would suggest danger or trauma, but allows the normal signals to come through so that this appears to the immune system as the patient's own hand. And indeed, we are working with this agent in other organ systems as well to have a generalizable effect and impact to provide transplantation without encumbering individuals with immune suppression.
If it's okay, I would like to probably ask Dr. Ruch if he can provide a little bit of a context of how the procedure went and the number of people in the operating room and how the team during the surgery went.
Thank you, Allan. I think it has to be emphasized that this is an extraordinary team that has come together under Dr. Kirk's leadership and Dr. Cendales' close personal supervision. There were 17 surgeons in the operating room involved in the operation. The procedure started literally with all of us assembling at 2:30 in the morning to go over our individual assignments. We were set and ready to go at approximately 5:30. The procedure took exactly almost 12 hours and was a combined effort of many of the people that are here in this room and many who were not able to be here, but multiple teams of anesthesiologists, multiple teams of nursing staff, as well as a host of the Duke Hand Surgery faculty, fellows, and staff, all of whom were there and rolled up their sleeves and started work immediately. There were a total of 34 individuals who were participating in the care during that time period, and it was everyone had their own assignment. Everyone knew exactly what was expected of them, and it worked much like an army would work to make this happen. I would emphasize that this was extraordinarily expedient. We worked very efficiently because time is of the essence in this situation. We are dealing with a situation where if the limb has been without blood supply for too long, no matter how hard we try, we can't get the limb to receive blood anymore. So we worked very rapidly, very efficiently to get the bones reassembled and then to assemble the vascular system, arteries and veins, and then we went to the nerves and the tendons, and it was a team. It's an extraordinary team approach. So I'd like to thank everyone who was available, who helped, because without them this could not have occurred.
This is for Mr. Chavez. So fewer than 90 people in the world have received a hand implant. How special do you feel?
I feel well, but I think I should not feel any better or any less well that the other people that have received transplant before. But I think that I feel that I feel the same way they felt during their first days post-surgery. Happy.
I don't know if this is looking too far in advance, but are you already preparing for another transplant?
So our program is funded by the Department of Defense for more transplants. So we are actively recruiting and have been recruiting patients, and we look forward to offer this option to as many people who have lost one or two hands. We are open to evaluate, and the only thing they need to do is just give us a call, and we will be just happy to see them and to provide the information, and we will be doing more. Okay, I think if there are no other questions, is there any other question? Yes.
So what was the procedure between when the donor passed away and the hand was removed from the donor and placed on to Mr. Chavez? How much time passed between then, and was there another surgical team that removed the hand from the donor?
So this follows the guidelines of any other solid organ transplant. And that's in broad terms. There's a team that procures a hand in collaboration with our organ procurement organization. And there's a team that is at the hospital taking care of the patient. And then once the organ comes to the operating room, then we continue working in separate teams until both are ready to be transplanted, at which time, as Dr. Ruch was saying, there were teams rotating until the surgery was completed.
How long did you have to wait for to find a match for Mr. Chavez?
So in general, it follows the same as any other organ. The patients are, or the recipients are, or the candidates are placed on a waiting list. For Mr. Chavez in particular, it was within a week.
She called me and say, "Ready?" No, I'm not ready.
I know you said that the donor is remaining anonymous, but Mr. Chavez, are you aware of who that was? And if so, have you had any contact with the family? And if not, what would you say to the family?
Hay que ser cuidadoso con eso, pienso yo, porque
We have to be careful about that, I think,
fue algo
because
doloroso
it
para
was
las familiares
something
de esa
painful for
persona.
the family, the relatives of that person.
Sí,
And
pero yo estoy en la mejor disposición si ellos quisieran conocer al receptor.
but I'm willing, if they want to meet the
saludar y
recipient of that
platicar y en
hand,
su momento
I am willing to talk to them and
tener algún tipo de
have a
amistad.
conversation with them
Yo
and
estoy
even
en la mejor disposición.
make
Y
friends with them.
agradecerles de antemano
And I want to
lo que hicieron
thank
por
them because of what they did, for what they did.
What would you say about what it means to you and how it enriched your life?
¿Qué diría usted sobre sobre lo que significa para usted y cómo esto va a cambiar su vida. What I would say, how it changes my life. I think that there's going to be a lot of change, but I think time is needed for me to explore everything. Maybe now it's more difficult for me to do the things that I used to do before. But I think gradually, step by step, I will be getting better at it and comparing to the time when I lost it. I don't know if that answers your question.
Question?
I know this is an uncertainty and a variable, but how much function do you expect Mr. Chavez to gain in his hand?
So our study, the result of the study is the comparison of the hand transplant function compared to how the patients were before the hand transplant. So it's a very individualized result. So we will evaluate, our endpoint is going to be at 1.5 years. And what we do is we have a test that we quantify how much he can do. There are many other ways that one can measure success. In the case of a hand transplant, because it's a visible transplant, unlike all others, body image is also an important component of it. So we will be following closely Mr. Chavez and all of our patients to on that regard.
Mr. Chavez, simple questions. Do you feel whole again?
That's a good question.
Ahorita, como yo ya estaba impuesto de la otra manera, ahorita es
Now,
al revés.
since I was already used to being the other way, now it's
Pero
the other way around. But
ante la gente, por decir así, sí.
I mean, for the rest of the people, yes. That's it.
And I was wondering if Dr. Ruch could elaborate on what 17 surgeons, what was, if you could elaborate on how the team was broken down, who was doing what here.
So it's effectively two separate operations, really. You have one team of 4 surgeons and assistants who are working on the donor limb. And that is an anatomical dissection of all of the structures, arteries, nerves, muscles that go down into your hand. And that is technically challenging. The exact same process is occurring on the other side of the room with Mr. Chavez, where the exact same identification of those structures that need to be reconnected, if you would, is occurring at exactly the same time with exactly the same team. Then you have to deal with assembling the skeleton, which is an important part of this. So we have to make the limb the same length as the other limb, right? And you have to put the bones together in such a way that they will heal with plates and screws. And you have to do this in a fairly time-sensitive fashion because you want to reestablish the blood flow before that critical time period occurs where the limb will not accept the blood. That is done with a microscope. So the suture that we use to fix those vessels is smaller than your eyelashes. You can't see them without magnification. Then once we have the arteries assembled, then blood starts to come out of the extremity, but there's no place for it to go. So you have to then hook up your veins, and we have to get blood to come out of the hand. And only then can we start to actually do the operation, which is to put the nerves together, because for this to be a functional extremity, we have to have feeling in it. Then finally, we want to hook up the muscles that he has in his arm to the muscles that the donor provided, so that those muscles will start to be effective. And you can see that he can actually now move his fingers on the basis of that reconnection. The real success is going to come with the reinnervation, where the nerves grow like the roots of a plant from his arm down into the donor hand. And that's going to be the real test for whether this is a success. That's going to be the, and I will tell you that our experience has been that that occurs slowly. In a traumatic situation, it happens at a rate of 1 inch in a month, so that's a very slow process. It actually is occurring faster in the hand transplant patients, and ultimately that's going to be what I think is going to provide him with the satisfaction of having a new hand.
Just a quick follow-up on that. The process you described, how much of that can you pre-plan and how much has to be just improvised in the operating room based on what you find?
This is all completely pre-planned. This takes a team approach, assembling in advance, examining what tissue we have to work with, what the donor is giving us, what the recipient is giving us. We have to look at the blood vessel anatomy. We have to look at the bony anatomy, and we have to measure all of that out so we know exactly how long to make the nerves, the arteries, and the bones. So this is a very intensive planning process, and then we have to assign everybody to a specific task. So it is, the planning is critical.
Okay, I think if there are no further questions, I would like to thank everyone for being here, and we look forward to the next time.